Early 2020, Covid-19 struck the whole world by surprise.
The coronavirus is spreading so quickly around the globe
that the coronavirus.
About the coronavirus.
Coronavirus, you know that, right?
3.2 million Americans have filed for unemployment benefit this week.
Economies around the world have worsened, cities have shut down, and the world appears to be at a pause. It may feel like the end of the world right now, but epidemics and pandemics have happened throughout time again and again. Now more than ever, we are experiencing an increase in new emerging infectious diseases. Population growth, globalization, ecosystem disruption, and climate change make us much more susceptible to infectious diseases. Fighting infectious diseases basically takes 4 steps. Number 1, we must find ways to prevent illness. Number 2, we must find ways to quickly detect infection spread. Number 3, we must figure out how to slow down the rate of infection. And number 4, we must find a vaccine. Poorer communities, overcrowded urban areas, and locations of natural disasters typically suffer from unhygienic conditions. One main issue is the lack of clean water. Diseases like cholera and diarrhea can be prevalent in these areas. To fix this issue, it is essential that governments provide relief programs after natural disasters and improve the poverty conditions. Additionally, there are wonderful organizations such as Charity Water that have been able to bring clean and safe water to poor communities all over the globe. Another source of infectious diseases is animal contact. More than 60% of emerging and re-emerging diseases come from animals. To prevent diseases from livestock, the CDC has set several guidelines to keep farm animals and humans healthy. When there is a disease outbreak, it is crucial that farmers take special measures to avoid the spread of disease from another farm or to other humans. Farmers can often be unaware of the risks of diseases, and they sometimes underreport diseases for the fear of economic loss. These issues can be reduced through educational programs for farmers. Governments should also provide reasonable compensation for economic loss due to disease. The illegal trade of wildlife is another big issue. The COVID-19 virus is believed to have originated from a vat virus and vectored to humans from an animal most likely at the wet market in Wuhan, China. China drives the global wildlife trade, and especially in wet markets, it is dangerous because it brings many species in close contact with each other and with humans. In January of this year, China strictly prohibited eating wild animals, and on February 14th, it started a permanent ban to prohibit illegal wild animal trade. Instilling cultural change is a long process, but the coronavirus appears to be a catalyst for this change. Hopefully, this ban is permanent. If not, we can expect to see another similar outbreak in the future. Every country has adopted some type of disease surveillance system. Typical systems gather data from hospitals and public health departments. Syndromic surveillance is a method of detecting the rise of diseases through absentee data, drug sales, and doctor's visits. On September 11, 2001, a syndromic surveillance system was put in place in New York City emergency rooms to detect any bioterrorism threats. 1 week later, there was an anthrax scare, which heightened the importance of a better surveillance system. Now, social media has been incorporating its data to help surveillance systems. In the 2012-2013 influenza season, an AI system that monitored tweets was 85% accurate when predicting influenza. Facebook has become involved, and through its user data, satellite imagery, and census data has been able to create population density maps. AI and data collection have a huge potential in detecting diseases. The incorporation of flight data, cell phone data would make it even more accurate. The earlier the detection of a disease, the faster it can be stopped. Fighting a disease requires that countries rapidly share information, coordinate on measures, and report to the public. The World Health Organization adopted the International Health Regulations in 2005, and it requires countries to assess themselves on their healthcare capabilities. It also shows which countries need more resources during an outbreak. Forecasting is also a useful tool that can be used in the future. Dr. James Wilson argues that the surveillance system data should be used to create disease forecasts that are made available to the public.
Welcome to your National Infectious Disease Forecast Center.
Partly cloudy skies with a chance of chicken pox. Woohoo! There goes forecast mode here in black and white. With a chance of an ulcer. We now have operational forecasts for infectious disease. There are no more excuses. We can get ahead of drug resistance. We can get ahead of these outbreaks. We can get ahead of these epidemics. And we can dispel the fear once and for all.
If there's an outbreak, people would be aware of when and where they would have to take specific safety measures. To slow down infection, it might be beneficial to look into precision medicine. Precision medicine is specialized medical treatment for people depending on their genes, their medical record, their environment, and their lifestyle. The US and UK have taken initiative to scale up genome sequencing in the upcoming years. Having people's genetic makeup on file can help determine which people are at higher risks when emerging diseases come up. This is beneficial because high-risk individuals can take higher preventative measures to flatten the curve. Having the data may also help reduce cost and time of trial and error medications. Lastly, Paul Cosford reminds us of one important thing. We must not forget the role that social behavior plays in spreading disease.
When somebody dies from Ebola, their body is covered in Ebola virus. If your usual burial practice is to wash the body and then take the water that you've used to wash the body and sprinkle it over the nearest relatives, particularly children, in order to ward off the spiritual cause of the disease, then you have a problem. And especially so if you know that your relative will not reach the afterlife unless you carry out that practice. The answer to the future of infectious disease control lies, as in so many aspects of things that I'm sure we'll discuss today, in combining excellent new technologies with a basic understanding of our humanity and social drivers of disease.
Vaccination is the only widespread measure we have to combat viruses, and time after time, it has proven to be the most effective and well-tested to prevent diseases in humans and in domesticated animals. Currently, there's a growing anti-vaccination movement. Despite this, vaccination continues to save lives and prevent millions of cases. New vaccines aim to use nanotechnology and mRNA to improve efficiency and production rate. Vaccines use nanotechnology to create effective antigen delivery systems. Current advances include liposomes, emulsions, polymer-based nanodelivery systems, and carbon-based delivery systems. Liposomes are made of phospholipid bilayers that are capable of delivering antigens and immune system enhancers at the same time. Emulsions are relatively stable and are capable of delivering several unmixable liquids, for example, liquids that are oil-based and water-based at the same time. Synthetic and natural polymer-based systems prolong the release of antigens over a longer period of time. Lastly, carbon-based systems don't degrade and can be a good candidate for oral vaccination delivery. Along with nanotechnology, mRNA vaccines inject mRNA sequences that code for specific antigen. Your body produces the antigen and it gets recognized by the immune system. mRNA vaccines are more beneficial than current vaccines because they are safer, more efficient, and can be produced faster. As of late March, there have been about 40 COVID-19 vaccines in the works. Currently, no mRNA vaccines have been approved, but the coronavirus might change that. The company Moderna is leading the way with an mRNA vaccine that is already in clinical trials. There are high hopes for this vaccine, but there are questions about how effective this new technology will be and whether Moderna will have the ability to do the upscale production to the levels of pharmaceutical giants. Well, that was a lot of information right there, but here's a simple summary.